Hello everyone. Do you or someone you know have glasses or use contacts? Have you ever wondered about the possibility of being able to see clearly without the need for glasses or contacts? Well, all of these ideas are those that researchers in the field have been working on for many years now in the form of laser eye surgery. Today, we will learn about LASIK, one of the most common types of refractive eye surgery.
Disclaimer: this video does not encourage nor discourage laser eye surgery. Please visit your healthcare provider should you have any questions about LASIK.
Let me introduce you to Dylan. He is a 26-year-old student athlete. He currently plays on his school's varsity soccer team, and he is hoping to play for Team Canada in the near future. Dylan has had glasses for over 10 years now, and his prescription has remained consistent for a very long time. His glasses did not bother him too much in high school, but they now hinder his performances in games because he is playing at such a high level. After learning about the possibility of laser eye surgery from a family member, Dylan thinks he should make a visit to his eye doctor to get information from an expert to help him make a decision. At the clinic, Dylan meets Dr. Hopkins. Dr. Hopkins has been attending to Dylan ever since he first got glasses and has monitored the development of his eyes for over a decade. Join us in the in-depth look at LASIK eye surgery with Dr. Hopkins to help Dylan make an informed decision about eye surgery.
Over the past 2 decades, a variety of refractive surgery techniques have been developed and marketed as simple and safe alternatives to glasses or contact lenses. Laser-assisted in situ keratomillosis, also known as LASIK, is the most common type of refractive eye surgery used to correct vision. After LASIK eye surgery, the majority of patients do not require the usage of glasses or contact lenses. Family physicians can help patients make informed decisions by looking into their values, preferences, expectations, and tolerance of uncertainty and risk.
The actual procedure and surgery information for LASIK can be broken down into 4 major steps. The overall goal of the surgery is to make permanent changes to the shape of the cornea to improve sight. By changing the shape of the cornea, this is what allows individuals to be able to improve their vision. The first step includes pinning the eyes open so the patient is unable to blink, and following that, numbing drops are applied to the eye, essentially putting it to sleep, so there's no pain for the patient. This is basically local anesthesia for just the eye. Then the surgeon uses a laser or a tiny blade to cut a flap in the cornea so it is exposed. Now for the actual laser part of the surgery. A computer-guided laser then removes a predetermined amount of tissue from the layers of the cornea, changing its overall shape. The flap is then returned to its original place and the eye is left to heal. Unlike your typical surgery, there is no stitches or anything, so patients need to be careful following surgery to not disrupt the flap healing process. Patients should be able to see clearly in as little as 6 to 12 hours after the surgery, but it can take up to 5 days to be able to see clearly. Patients also need to keep in mind that just because they can see clearly does not mean that they are fully healed. The ideal candidate for LASIK is anyone in the age range of 25 to 40 years old. Another requirement is that you have needed to have a stable prescription for glasses or contacts before the surgery can be performed. This is why the age is usually over 25, because by then most people usually have a stable prescription. Some other important factors are eye health and ideal corneal thickness.
What conditions does LASIK surgery treat? LASIK is mainly done to treat conditions affecting vision, mainly myopia, hyperopia, and astigmatism. Myopia, or nearsightedness, causes difficulties in seeing objects at a farther distance. This is due to an elongated eyeball, which focuses the image in front of the retina rather than right on it. Hyperopia, or farsightedness, causes difficulties in seeing objects at a close distance. This is due to a shortened eyeball, which focuses the image behind the retina. Finally, astigmatism causes blurry near and far vision. This is due to a misshapen cornea, focusing different light beams at different locations in the eye, rather than focusing all of them at one location on the retina. LASIK surgery has been shown to correct a range of prescriptions, which are measured in diopters, meaning the focusing power of the eye. Myopia can be corrected to a prescription of -12 diopters, hyperopia can be corrected to +6 diopters, and astigmatism can be corrected up to 6 diopters. Additionally, 90% of patients achieve 20/20 vision or better. There are some risks that patients should be aware of when thinking about getting LASIK surgery. These include dry eyes due to a decrease in tear production, glare, halos, and double vision, under or overcorrections due to removal of less or more tissue, respectively, astigmatism due to uneven tissue removal, corneal infection due to complications when the flap is pulled back, regression, which means that vision returns back to its original prescription, and more unlikely cases of vision loss and transient light sensitivity syndrome can occur. Patients with the following conditions are at a higher risk of complications. These include autoimmune disorders, weakened immune system caused by immunosuppression drugs, dry eyes, recent changes in vision due to pregnancy, hormonal changes, medications, breastfeeding, or aging, inflammation of the cornea, lid disorders, eye injuries, or eye diseases such as glaucoma, cataracts, and herpes simplex affecting the eye area. Here is what to expect when patients go in to get their LASIK surgery done. In order to prepare for the surgery, patients should ask their surgeon in advance when they should stop wearing their contact lenses. Additionally, any eye makeup should be removed in order to reduce risk of infection. Avoid smoking or consuming alcohol prior to the surgery, and a person to drive you should be arranged. After the surgery, you may feel irritation, gritty sensations, light sensitivity, or blurred vision for about 24 hours. Your surgeon may prescribe eye drops or pain medications, as well as post-operative instructions. Finally, driving should be avoided for at least 3 days.
Looking at the pros and cons, LASIK is a relatively quick procedure and can be done in about 20 minutes, and most of this time is allotted for setting up the procedure itself. The results come into effect very quickly, as patients will notice differences in a few hours and can notice relatively improved vision by the next day. Lastly, LASIK eye surgery can be considered as a life-changing experience for patients because they can now enjoy activities that were once hindered by their poor vision. Looking at some cons, the eligibility requirements are very strict, and not everyone that would benefit from laser eye surgery is eligible. For example, individuals over the age of 40 may be unsuitable for the surgery because they have a condition in which the lens of the eye becomes stiff and hinders close-up vision. Additionally, although the technology has improved over the years, there are risks, including experiencing dry eyes for up to 3 months and other uncommon side effects such as nighttime glare. The flaps created in LASIK are not secured, so trauma later on in life can dislodge these flaps. Lastly, those with a higher prescription may need to have another surgery done because they may notice a decrease in quality of vision over time, also known as myopic regression. The LASIK complication rate is less than 1%, which includes infections as well as dislocations of the corneal flap that is made during the surgery. These cases are referred to as complications because they require additional treatment. That being said, about 30% of patients report experiencing short-term side effects as well. With that in mind, there are a lot of different factors to consider when making your decision. You should not make a decision on this information alone. It is important to conduct thorough research with your healthcare provider prior to making a decision on laser eye surgery because cases differ from one individual to another.